I don't really know what happened, but I was talking about the thyroid. I had pulled this card for our conversation, which is Motherwort, Strength, talks about fertility, embracing your destiny, creativity, things like that. And then I was getting into like the thyroid hormone and what I wrote about earlier this week and how you can definitely naturally enhance the thyroid hormone that you're producing. And your beauty is correlated with how much thyroid hormone you have because the thyroid essentially binds to your skin receptors and it also helps to create energy for all of the cells of your body. So whether you want to grow your hair longer, whether you want glowy skin, long nails, all the things, you need an adequate amount of thyroid hormone. So I kind of was closing that up and I was going to open it up to any questions from the Apothecary. And then I'm going to go through some of the paid subscribers send me questions like once a month. So I'll go through some of those if you guys don't have any questions. But I'll give it a little. So you can type a question if you want. Okay. And it doesn't have to be about the thyroid. It could be about health, life, doesn't really matter. I will talk about it all. Okay. So one message I got this month was, let's see. I'm not sure if she's on here. Her name is Marissa, but she essentially asked me about let's see, what would say is optimal range for thyroid hormone levels? Oh, that's a good question. Okay, let me just pull up my lab notes. So, in general, if you see your doctor, like they're gonna essentially give you like the typical range of the thyroid hormone. So, if you're looking at your labs, uh, it won't flag it unless your TSH is essentially below or above zero point 0.5 to 2. So nothing's going to get flagged if it's within that range. If your free T, so there's like multiple layers to test the thyroid, which can get a little bit confusing, but your free T3, which is essentially like the less optimal type of thyroid hormone, that can be from like, you want that from like 5 to 7. Anything under 5, which is not often flagged on your tests, is going to be suboptimal or subclinical hypothyroidism. So you want at least a 5 when you are looking at your free T3. When you're looking at your free T4, you want that to be at about like 15 to 23. You don't want it over 23 and you don't want it under 15. But typical standard referencing is going to not, it won't flag the T4 unless it's like under 9. So that's why it gets a little bit confusing. And if you're not a doctor who's trained in like preventive health, which most doctors aren't, unfortunately, then you would see someone's thyroid with a T4 of like, what, like 12, and you would be like, okay, you're good. You don't have hypothyroidism. But that's not true, right? Your T4 at 12 is telling me that your body is having trouble producing the thyroid hormone at the level that is necessary for adequate functioning throughout the body. So even if I can't sit here and call you hypothyroid because you still have thyroid hormone, something is not fully optimal. And that is where it gets a little like sticky. And that's why when you go to like, traditional PCPs, like they're happy to let you leave with like subclinical hypothyroidism. And that's kind of the issue with healthcare and medicine in general, but I digress. So that's what I would look for personally if I was seeing you as a client and I was concerned about your thyroid being functioning. If I saw something under 15 in the T4 or under 5 in the T3, then I would be like concerned. I hope that answers your question. Does anyone else have any questions on the thyroid or any other questions, health questions that I can answer before I start getting into my inbox? Okay. So I got a question from one of my paid subscribers, and she was interested. Wow, I didn't realize that I was supposed to be testing for the three forms. Yep. Yeah. 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 So that's also a thing. A lot of PCPs will only test TSH because TSH tells you essentially if your body is wanting more thyroid hormone. If you have a high TSH, this can be counterintuitive, but thyroid stimulating hormone is what your TSH is. And so when you have a high TSH, it tells us that your body wants more thyroid hormone. Whereas if you have a low TSH, it tells us that your body is probably producing enough. So most PCPs will only test for the TSH and they won't test for the T3 or T4. And that therein lies the issue because your TSH could be telling us that you've got adequate thyroid hormone, but if we test for the T3 and the T4, you could be in suboptimal range. And that's why it is very, very common for people to walk around with subclinical hypothyroidism and not have a problem until they try to get pregnant or something that requires a lot of thyroid hormone. And then they're kind of like, you know, they're kind of like behind because it's like this thing was there, but no one went looking for it. And so, I'm not someone who loves like a lot of lab tests, but I definitely do think that some are necessary to understand what's actually going on underneath the surface and to get to the root of things. And that's really, what I specialize in is like getting to the root. Like I'm not necessarily I'm not a PCP, right? So you don't come to me to like do all these tests, but you come to me to figure out like what's underneath all of these tests. And that's where like my expertise tend to shine for sure, like in my client appointments. So, okay, so this person is asking about cortisol and how it affects your cycle. Essentially, she had an experience of having like very limited cycles when she ran, I guess, back in the day. Yeah, she was a runner. She would run like 30 to 40 miles a week and her cycle started to come twice a month. Uh, okay. And then periods of her shortened cycles at 23 days. Okay, so essentially she's asking, how does cortisol affect the cycle? And then why would a cycle be short? So these are two different mechanisms happening. And for her, definitely we'd have to get into like what the main profile that exists right now for her is. But essentially, what can happen with cortisol is high cortisol, which we know is like the stress hormone, it can essentially increase when you put your body under a lot of stress. And for women specifically, like women do not thrive with HIIT or like running or, that's not to say don't do it. It's just to say that our hormones do not thrive in that environment. Like we like a more balanced level of cortisol, especially if you have a high cortisol life. You definitely don't want to be doing physical activity that is also high cortisol because you're just like overloading your cortisol receptors and your adrenal glands are all whacked out at that point. But when you do have high cortisol, what happens in terms of your hormones is it causes you to produce more testosterone. And so when you release high amounts of cortisol, you increase the shunting of your androgen hormones like androsterone, which is the precursor to testosterone. You increase how much is being shunted towards testosterone. And Essentially, when you have that happen, it really just depends on, like, what your issue is, like, whether or not you have, like, high estrogen or low progesterone or, like, what's going on here. This woman's profile is giving me more of, like, a low progesterone profile, and so that's likely why she essentially had periods every 2 weeks. Like, if you don't have progesterone, then your body essentially gets used to just high amounts of estrogen and then estrogen withdrawal, and it doesn't stabilize on progesterone. And progesterone is what actually gives you longevity when it comes to your cycle. So it gives you like longer cycles when you can preserve more progesterone and not have so much estrogen. And so in this case, there could have been like some shunting into like estrogen and testosterone from the cortisol, and that could have been leading to this whole picture. Um, but essentially now she's saying that our cycles are 23 days, and that tells me that there's a progesterone issue. Like, as we get older, our progesterone that we produce decreases just naturally. And so one of the things that women have to do, and something that we're not taught, but it's really important as we go throughout life and kind of enter more into like our menopausal days or premenopausal days, is like you need to preserve as much progesterone as you can, because that's not something that you can like reproduce over time. Like if you stop producing progesterone, you stop producing progesterone. So there are things that you can do to kind of get your progesterone better, and one of those things is limiting your cortisol release. So you really want to preserve your progesterone. And so her picture is kind of telling me that she's low progesterone. And so things that we would do together would be getting her progesterone definitely higher, trying to increase her period days, making sure they're a lot longer. Um, yeah, that's what I would say. And then, and feel free to like ask me questions on here while I'm like looking at questions here as well. It's like I can definitely do both. Mm, okay, let's see. Okay. Um, Okay, I have just kind of like comments about things that I wrote this week, which is awesome too. I love to hear your feedback. Um, I do read pretty much everything because this is my little corner of the internet, and I love my little corner of the internet. Um, okay, I did get a question about deepening spiritual gifts, and this might seem left field, but this is who we are. Like we go between the two, and that's just how it is. But okay, so I did get a question about sharing spiritual gifts and how to like deepen them, and also how to be more comfortable like sharing those online, and like I guess just showing up more authentically, and is kind of how I'm reading it. And yeah, I think everyone has like a different way that they have to kind of do that. I think for me, I find that my gifts are a lot clearer and a lot more present when I have more time like quiet. Like I meditate every single morning for, 10 to 20 minutes. It just depends. Um, and I found that your gifts are stronger when your nervous system is calm. So just being able to create the circumstances for your nervous system to be calm, so that when you do get insights or you get downloads or you get things that, maybe you're really good at like astrology, and sometimes you don't feel super connected to that. Like I find that you have to make the space for information to come through. And so like lately, if you've been following me for a while, you know that at the beginning I wrote a lot about like medical astrology and astrology in general. And I kind of like shifted away from that because I wasn't feeling as connected to medical astrology. And then over the last month, literally the last month, my, like, channeling for medical astrology has just been, like, coming online really intense, and I think part of it is because I'm at, like, 200 days literally of meditating at this point for 10 to 20 minutes a day, or it's, like, 224 days I've been doing that, and I'm definitely, like, a very disciplined, regimented, like, kinda person like that. Like, I like my days to flow, but I like to have certain things that, like, ground me throughout the day. So, that is one of them. I find that, like, my channeling and my gifts, even when I'm, like, being intuitive in my client calls, like, that's definitely more on point when my brain is calmer and there's not as much, like, fuzz or thoughts going around. And then if you just kind of want, like, a practical way to, like, open up your crown chakra, like, rosemary is always gonna help you. So I use, like, a rosemary aerosol. Earlier I was talking about how I'm writing a piece next month on, like, ancestral princess hair rituals, but I'm adapting it for, pretty much, like, 4B or 3B, 3C hair and coily and kinkier hair. Um, so that's gonna come out next month, and I talk about different herbs that, uh, like, ancestrally were used to do herbal rinses or do, like, oiling, things like that, because my goal is to pretty much, in the next couple of years, have my hair, like, curly down my back, and I realized I was not gonna reach that goal. Well, I didn't even realize it was just kind of, like, an intuitive hit where I was like, "Oh, like, if I want this kind of hair that they had in like, ancestral times, then I'm going to have to do ancestral things with it. Like, I'm going to have to be more intentional about what I'm using, and so, uh, a lot of the products they used had rosemary in them, and so naturally, they were actually more, intuitive and connected to, like, their intuitive gifts. So, that is my answer to that question. A little bit of a practical and a little bit of a yeah, just what I do. Um Oh, and then she also asked about, like, how to get more comfortable sharing on platforms like this. I I feel like I'm not the best person to ask, or maybe I am the best person to ask because I'm not so good at this either. I am, like, definitely more of a private person. I have a Capricorn moon in the 12th house, so I keep a lot of things that I experience, like, really close to my chest. I actually wrote about this, I forget what essays I wrote for this month, but newsletters that I wrote. I think I wrote about it in perfectionism will hold you back and stop you from living your purpose, because I I definitely struggle with perfectionism, and I talked about this, like, earlier in the live where I have, like, a Virgo in my 8th house conjunct, um or with Chiron and, Mars conjunct. So it's, like, a very perfectionistic energy, and because of that, sometimes I find myself, like, wanting to write something perfect about what I'm experiencing, or, like, trying to, like, write from this place of, like, being on the other side when sometimes I'm not on the other side, like, I'm actually very much in it. And so one of my goals for, like, the next year inside of the Apothecary, and just in, like, each article that I write now moving forward, is to be better about sharing where I'm at in my process right now, and getting a bit more granular with it and a bit more transparent about, like, where I am on my journey. Because I feel like, yeah, like, recently I've actually gotten a lot of questions, which I haven't really touched on in this, but questions have been floating through about people who, like, wanna know how I built, like, a Black women's apothecary, or, like, how I got out of healthcare and started writing and things like that, and, um, I think I'm really good about sharing what it was like, and I'm really good about sharing the future, but I'm not so good about sharing the messy middle, and so I think a lot of the messy middle comes down to perfectionism, and so that's why I chose to write about it this month. But I actually think that so much of being able to share your story, being able to, like, be really authentic online and show up and tell people what's going on for you and what's moving through you, and just being really honest about that stuff, it does come down to perfectionism. Like, it's letting people see the mess, letting people see that you're not necessarily on the other side of what they're in, but you're maybe like 2 steps ahead of them, and that's really where there's, like, so much to learn. Like, even now when I'm looking for, uh, people to kind of expand what I think is, what reality can be, I'm looking for people that aren't necessarily, like, all the way out there. Like, I'm looking for people who are, like, 2 to 3 steps ahead of me that can show me, like, this is possible, and, like, tell me how they got there, things like that. And so I think that the only way to, like, be that for someone, which in the new age, like, in this new astrological shift that we're going through in the Aquarian age is like, you are going to want to look to people who have what you have. Like, do not ask for advice from people who do not have what you want. And I think back in the last 10 years, we've definitely gotten the habit of that, like asking people for advice that maybe don't necessarily have the thing that you want. But as we move into the Aquarian age, it is more of like seeing the in between, like seeing the messy middle so that you can see, okay, this person has gotten to the place that I want to be at. And like, what did they do to get there? And so, yeah, I'm on my own journey with sharing more about what my experience is. This month is definitely gonna be a lot of that. It's a lot of the messy middle. Um, I like, literally, I have, like, 4 already queued up, which, like, one of them is, like, perfectionism will hold you back and stop you from living your purpose. I believe in abundance and still struggle financially. Here is what I learned. I have being a bitch will save this is my favorite one. Being a bitch will save your life. This doctor says so. And then I manifested my dream job after a career shift in 8 months. Here's how I did it. So I'm getting more into like the details, the granularity of like my life, how I live it, and the things that I still struggle with, is kind of the point. And it's not always pretty and it's not always perfect, but it's authentic. And that's genuinely what we're all here to do and be. And like, just show up as for people is, like, be the most you can be. Like, that's all. Um, okay. So, I think that's, like, all I really have time to answer today, yes, for. Okay, so every month I do this group health coaching. I'm thinking about bringing on some of my health clients for the next couple of months just to talk about like specific things that they were dealing with and how I kind of help them move through those things. And then inside of the Apothecary, paid subscribers always can send me questions and I'll either answer them in these lives or I'll answer them in a post or I'll answer them in a comment. Like I'll message you back. It just kind of depends how the month is moving. Um, and then what else? Oh, founding members, so the VIP membership, we have another live in the middle of the month. So if you're a VIP member, then I'll see you again for that, where we get to get more into like your health things and I can be a bit more like specific, and not so general. And then yeah, the next live is gonna be on August 28th. So I hope I'll see you there. Thank you for joining. Um, Again, this is the card that I pulled for today out of my really cute herbal astrology deck. Just like one of my favorite decks by the woman who um, founded Anima Mundi, which is a really beautiful herbalist brand. But yeah, I hope you guys have a good weekend. Definitely keep sending your questions. Keep letting me know what you think on my posts. And thank you so much for being a part of a Black Woman's Apothecary. It's like always a dream come true being able to hold this community and teach to this community. And I don't know, just like live in this community. I feel like oftentimes I'm not teaching, I'm just sharing. So I just feel really grateful. Um, and yeah, thank you for being here.